I'm Dr. Beth Jaklic, and I would like to go over the instructions for your colonoscopy preparation. Your bowel prep is critically important as it affects the quality and the safety of your examination. Not following the instructions below exactly could result in having to cancel and reschedule your procedure. We really need your colon to be squeaky clean in order to spot small polyps or lesions if you have any. Thanks for taking the time to watch this video, and please make sure that you read the written instructions carefully as well. These instructions include management of any potential blood thinning medications well ahead of time, as well as the diet to follow the day before your colonoscopy and the prep medication to take the evening and night before your colonoscopy. If you have any questions about any of the instructions, please call the office at 757-412-4919, or if necessary, the on-call nurse at 757-620-6612. There are some medication changes that you may need to follow up to 7 days prior to your procedure. Blood thinner or clot preventing medications need to be addressed well in advance so that we can have you stop them if appropriate. If you are taking any type of prescription blood thinners or antiplatelet medications like aspirin, Plavix, Xarelto, Eliquis, Coumadin, Pradaxa, etc., you will need to alert our office in advance so that we're aware of what you're taking and can advise you on what you should and should not stop. This may involve us contacting your primary care provider, cardiologist, or neurologist to determine if it is safe for you to stop these medications, and if so, for how long. Please do not stop any medication until you have heard from us. We also ask that you not take any over-the-counter or prescription non-steroidal, arthritis, or pain medication like aspirin, Goody's powders, Motrin, ibuprofen, Excedrin, Aleve, etc. 5 days before the procedure. Tylenol or acetaminophen, on the other hand, is fine to take and can be a good substitute for these medications in the meanwhile. Now for the prep itself. While there are many different colonoscopy preparations, our preferred preparation is a tablet-based prep called Sutab, which is available by prescription. The tablets are fairly large but can be cut in half. If you cannot take tablets, please let us know and we will give you an alternate prep. We can send your prescription to your local pharmacy if you prefer. We recommend that you pick up your prep as soon as possible in case there are any issues with insurance or with availability. The prep itself is simple and includes your preference of clear liquids as well as the Sutab tablets. On the day prior to the procedure, you will start by taking only clear liquids from the moment that you wake up. Drink plenty of liquids throughout the day to help with the quality of the prep and to avoid dehydration. These include clear juices like apple juice or white grape juice, bouillon broth, black coffee or tea, Kool-Aid, sports drinks like Gatorade, ice pops, and Jell-O. Please do not take any milk products, solid foods, smoothies, alcohol, or anything colored red or purple. The tablet prep is divided into 2 parts, which leads to a better result and a more tolerable prep than if it is done all at once. You will need to stay near a bathroom at this point. The prep usually produces the first bowel movement within an hour or 2 for most people, but can take as long as 5 hours to start. This will be the first part of your 2-part cleanout. Between 4 and 6 p.m. on the day prior to your procedure, you will begin the laxative part of your prep. Open your first bottle of Sutab, which contains 12 tablets. If you have trouble swallowing larger tablets, you can break these in half or even crush them. The prep kit comes with a 16-ounce container, which you will fill to the fill line with water or other clear liquid. Swallow all 12 tablets with this liquid over a 30-minute period, swallowing 1 pill approximately every minute. If you start feeling nauseated, you can take a small 15-minute break. About an hour after you finish the last tablet, refill the provided container and drink another 16 ounces of clear liquid over no more than 30 minutes. About 30 minutes after finishing the second container of water, drink another 16 ounces of clear liquids over no more than 30 minutes. You're done for now. You are free to continue drinking clear liquids if you would like. Early in the morning of your procedure, 5 to 6 hours prior to the start of your procedure, you will take the second identical dose of Sutab following the exact same steps as above. You can continue to sip on water until up to 4 hours prior to your procedure, but after this, please do not put anything in your mouth besides approved medication with a sip of water, and of course, your toothbrush. At this point, you are complete with your preparation and your bowel movements should be purely watery and thin yellow or light brown in color. Virtually all patients agree that the preparation is the only challenging part of the colonoscopy. When you arrive, we will get you situated and you will have a pain-free colonoscopy with modern, safe sedation. So the important thing is getting yourself prepped and ready to go. We will take care of the rest. If at any time you have questions or difficulty with your prep, please call our office at 757-412-4919 or our on-call nurse if after hours at 757-620-6612. While the prep can sometimes be a little challenging for some people, everybody should be able to get through it with minimal difficulty. The more that you are able to adhere to the instructions, the better your preparation and the quality of your colonoscopy will be. Thank you, and we look forward to seeing you soon.